Order! Order! You are an incorrigible delinquent at times. Behave yourself, man!
Welcome to our programme. This morning, do you support the junior doctors' strike? I'm just going to juggle some tablets here and screens. Peter Hepworth has already tweeted to say, I'm 100% behind the junior doctors and I'm awaiting an operation. And this on Twitter, use the hashtag #VictoriaLive. No, the British Medical Association is using these people to play politics with patients' lives. Let us know your own views. Since the beginning of 2016, junior doctors have been on strike 6 times, a total of 162 hours. They were due to walk out for 5 days next week. As you know, that's been cancelled, and that over patient safety. But they're still due to strike for 5 days in October, in November and in December. The row has been going on for at least 2 years, since England's Health Secretary Jeremy Hunt first proposed the new contract.
This all began at the tail end of 2012. Junior doctors in England needed a new employment contract. That's 55,000 people, about a third of the medical workforce. But by 2014, talks on a new deal were already proving difficult. The doctors' union, the BMA, was worried about working conditions and patient safety.
For years, it's been too hard to access the NHS out of hours. Heart attacks, major accidents, babies. These things don't just come from 9 to 5.
Then the Conservative Party went into the general election with a promise, making the NHS a full 7-day service. The government wanted to make it cheaper for hospitals and surgeries to rota doctors on in the evenings and at weekends. It planned to raise basic wages but cut extra pay for unsocial hours.
Save our NHS! Save our NHS!
There were marches and protests. Doctors argued the new plan was unfair and unsafe, and more investment was needed to pay for a full 7-day NHS.
I'm okay with working in the UK. I trained in the UK and I want to work in the UK, but I'm not going to work in an NHS England where this contract is imposed.
There were a series of strikes. The most recent saw junior doctors withdraw emergency care for the first time in history. Then a pause was agreed and talks restarted. It looked like a breakthrough was possible. The government offered concessions on weekend and part-time pay. The doctors' union, the BMA, said it had reached a deal it could finally recommend to its members.
What we wanted to see was a proper negotiation where both sides tried to find realistic solutions to the problems that junior doctors face across the NHS, and that's what we've come up with today.
But not so fast. The BMA still had to put the deal to its members, who still voted against it. The government said it would impose the contract anyway from this autumn. More industrial action is now likely, with a series of 5-day strikes on the cards. The first, planned for next week, has been cancelled because of worries about patient safety. The next, at the start of October, will go ahead though, unless an agreement can be reached.
Worth saying that the dispute over the contract is an England-only issue. Scotland and Wales have both said they will be sticking to their existing contracts, while Northern Ireland has yet to make a decision, this largely because they don't have the pressures on costs in terms of 7-day services. So, do you support the junior doctors' strike? Let's get a snapshot of views from our audience this morning. Hello, do introduce yourself.
Hi, my name's Alex. I'm a children's doctor and I work in South East London. I'm really glad that we're not going on strike next week because I wasn't ready. I've just joined a new department and I don't know whether me being on strike, whether the service can be covered adequately. But I reject the contract. I think this is an unnecessary and cruel intrusion into our working life. Also, looking at the wider situation, I think it's an attack on the NHS. We've already seen waves of privatisation. We had PFI under Tony Blair and Gordon Brown, and then Andrew Lansley brought in the Health and Social Care Bill. And today we're seeing the NHS that's been stretched because of those things. NHS trusts are financially almost ruined, and the NHS is, it's so stretched. And now Jeremy Hunt wants to drive away doctors with this new contract.
Do you actually believe he wants to drive away doctors? Do you genuinely believe that?
Well, I think he doesn't really care. I think he's got this manifesto that he wants to carry out, which was voted for by 24% of people, and I think he just has that short-term aim.
Yeah, hi, my name's Janice. I'm a junior doctor. I work in North West London. I'm training to be an anaesthetist. I am very mixed. I completely oppose the contract. I don't think it's not contract I want to work under. I feel completely disrespected by the government and Jeremy Hunt. We as a body have rejected the contract, yet they still think that it's acceptable to impose it. However, going on strike, as a doctor, you have responsibility to your patients first and foremost.
Can I interrupt, Alice? Did you support the earlier strikes in the year?
Yeah, I took part in withdrawal of elective care, and I opposed withdrawal of emergency care. Okay. Now, the forthcoming strikes that are proposed, it seems to me that 5 days of withdrawal of emergency care seems to be a very steep escalation. So I support strikes, but the proposed plan of action in a month's time, it doesn't sit particularly comfortably with me, and I'm not sure. Just withdrawal of emergency care and for such a long period of time.
All right. Do put your hands up, ladies and gents, if you want to get on air. Hi, good morning.
Hi, I'm Sid. I'm from Bishopstoke in Hampshire. I'm a community pharmacist. I get what I'm hearing about junior doctors. We've got the brightest and the best. And for me, the issue is twofold. One is the point you're trying to make, and the other issue is how you're trying to make that point. What are you doing about it? And that's where I'd inherently and respectfully disagree. The NHS has had years of broken promises. It's had chronic underfunding. It's left it fragmented, weak. Community pharmacists aren't happy. They want to close 3,000 pharmacies down. Nurses aren't happy. GPs aren't happy. This is not just a junior doctor issue. The problem with the strikes is that the NHS is not elastic. It's finite. You tinker with one aspect, has a domino effect right through. We're not just talking about patients being put out here. We're talking about their families, their jobs, the wider economy, so on and so forth. And the thing that really worries me is if the NHS is already crippled, it's already on its knees, how is the love of the NHS further going to be enhanced by junior doctors going on strike because the NHS can't cope with it?
Who is the junior doctor who supports the 5-day strikes? Stick your hand up. Okay, can you, Janice, pass that microphone? Yeah, do talk to Sid about the point he's made. Do introduce yourself as well.
Sorry.
Hello.
My name's Sandy. I'm an A&E trainee. I work in East London. I fully support these strikes, even the withdrawal of emergency care, because I know in A&E departments we have fantastic consultants who will cover us when we're not there. The strikes are going to be from 8 to 5 in the morning. If we were doing the ones next week, I would have come in from 5 to 11:30 to finish my shift after being on the picket lines. I agree with you that the NHS isn't elastic and we will have an impact on the NHS, but that is the point of industrial action. We feel like we've been left with nowhere else to go. There's no other alternative that we can do.
Sid?
Sorry.
Well, pharmacists aren't going to go on strike, nurses aren't going to go on strike.
But to answer that point, he feels there's nothing left.
Well, I think either the BMA have let you down, or I think that you need to really do far more in terms of reputation, because the danger you've got is the longer these strikes go on, the more isolated you'll be. Right now, there is some money in the system to help cover agency staff, temping, outside staff. The problem is that's taking money from other aspects of the NHS, and you're going to become more and more unpopular. Your point will be lost as more and more impact is going to affect those families.
I don't know if you saw that there's a YouGov poll yesterday which suggested that those people who believe doctors are right to strike is now at about 42%. That's down from April when 53% of people said doctors were right to strike. You must worry about that in terms of public support.
Yeah, I do worry about that, and public support is very important. I just want to make a point. We're not legally allowed to pay people to come and fill in for us. So extra money won't be put in for people to cover our jobs whilst we're on strike.
Alex, you want to come back?
Yeah, I agree. What option do we have? I mean, we're backed into a corner here. You blame the BMA. I don't think they've played their cards particularly right. They could have done better. But I blame Jeremy Hunt. I mean, Jeremy Hunt, back off. Just leave us. Leave us alone. Why can't we be like the doctors in Scotland and Wales who can concentrate on looking after their patients rather than having to agonise over having to contemplate feeling like we're rejecting our patients. We have this burden of professionalism, and it's a heavy burden, and having to relinquish that is something that is really difficult to contemplate. But what do we do?
Over here, hello.
Hi, my name's David. I'm an A&E nurse in a major trauma centre. I work alongside junior doctors. We're a very tight-knit team. We have to be. Obviously, it's a very busy department. I'm also a parent and a patient, a taxpayer, and also a trade union steward for Unison. And our branch has 2,000 members which have passed a motion supporting the junior doctors and their strikes. And I support them personally. I feel the blame should be laid at Jeremy Hunt's door. There's no need to push these doctors. They haven't struck for 40-odd years, or maybe even longer. They're intelligent, articulate and well-educated. They do 7 years of training.
Do you think 5 days of strikes each month is proportionate to where we are now, given that back in May, the BMA Junior Doctors Committee was saying, this contract now, it's OK, let's go for it?
It's not for me to tell the doctors what they should or should not be doing.
But do you think it's proportionate?
That's for them. I will support them 100%, whatever they choose to do. I know how hard they work. This whole idea of the 7-day NHS, we know that emergency services run 24/7. You know, I'm in them. We work nights and weekends and all the rest of it. It's the elective services that don't run for 7 days, and there's no budget for this. There's no money being put forward. The NHS has had its budget, although the sort of bottom line has stayed the same. What's happened in previous years prior to 2010 is that every year there's been between a 4% and 2% uplift because of the extra demand, and that stopped in 2010. So actually the money that's been going into the NHS for the last 6 years has declined, and that's why we've got Jeremy Hunt pushing forward this transformation and sustainability agenda, a plan that we know nothing about. He's not talked to the public about it. It's a £22 billion pound cut in funding. OK,
let's get other people in.
Sorry.
But thank you. No, don't apologise. Not at all, not at all. Take a seat. Hello. Hi.
Hello, my name's Lauren. I'm a GP trainee. I'm currently a 5th-year doctor, junior doctor. I want to say that I support the strikes and I'm against the contract imposition. In saying that I support the strikes, I hoped very much that they wouldn't happen. I think the escalation is quite scary, to go to 5 days walkout.
Scary for who? Scary for who?
Scary for us.
What's she scared about then?
I'm scared that our patients are going to be affected by this. Currently I'm working in obstetrics and gynecology. I know that the consultants and the senior non-trainee doctors will do an excellent service at covering the emergency side of things, but I appreciate that elective services like antenatal clinics, for example, will have to be cancelled so that those doctors will be released to cover the emergency services.
Can I ask you what it is about the contract specifically that you don't like?
I don't like that the government has recognised that it's a contract that disadvantages women.
And do you mean women or do you mean part-time workers?
I mean part-time workers who are predominantly women.
Yes, yes.
I think one of the good things about our old contract is that with annual pay increments, we've managed to avoid a gender pay gap.
OK.
Which is brilliant.
If Jeremy Hunt, if England's Health Secretary addressed the part-time workers' pay issue, you would accept this contract?
That's one small element that I disagree with. There are a number.
OK. So let's go through them. So there's the part-time workers and their pay.
Yeah.
What else?
It's a bit complicated, but non-resident on-call workers, so they're staff in areas like oncology, for example, who will work, say, a 9-to-5 shift, and then from that point onwards, they may be working from home, they may be working from hospital. They can go home if they're not needed immediately in hospital. They will be on an on-call type scenario overnight, with the sort of willingness to come in or to answer questions by phone.
And that's an issue for you because?
Because they're my colleagues and they will take a massive pay cut under the new contract. Currently, they're paid as if they are in hospital.
Right.
These shifts can vary. Some of them can be very onerous, some of them can be less so. But even if you're at home and you're not called into hospital, you're still waiting by the phone.
So we've got 2 issues with you so far. Are there more?
There are more, yes.
How many more? Just out of interest.
I don't know.
I remember, but Hugh Pym, our health editor, just to come in at this point, because I really do want to get to the specifics today if we can.
Well, I think, Victoria, in the last few minutes in this fascinating debate, we've heard one of the problems with this. For some people, this is all about privatisation, a 7-day NHS government policy For others, it's about quite technical details of a very technocratic employment contract. And the other complication is that the BMA Junior Doctors Committee and leadership agreed what was put forward and made clear that actually it had dealt with quite a few of these important issues. Now, I know there's an issue about who recommended it, and I quite accept it wasn't fully recommended by all the BMA. And obviously some people thought it addressed these concerns. But I totally get the fact, and it's important to point out, 58% then rejected it for their own reasons, and that is an important part of the debate as well. But I think some of these issues have got terribly confused in what is an employment dispute, basically.
Yeah, wider issues appear to be being attached to the contract dispute. But before I introduce our panel, let's go through your other issues. Why not? Let's go for it. So we've got 2 so far. What else, specifically and briefly?
So we've talked about gender discrimination, part-time workers.
On-call, we've talked
about the non-resident on-call.
Yeah.
I would like to see better protection for study. We have to remember that we are consultants in training. We're qualified doctors, but we're training to become consultants.
Okay, and the next one, I'm going to hurry you along, sorry.
Okay, sorry. But just to go back to that, if we're looking to spread us over weekends and nights more thinly, we get our training by working with senior members of staff.
Yeah.
And if we're spread more thinly, we're not going to get those opportunities. So that's quite fundamental, although the contract doesn't mention that specifically.
Now, that's the point. The contract doesn't mention that specifically. All sorts of people could have all sorts of concerns, anxieties, grievances, if you want to go that far. It's nothing to do with the contract. The contract's not about that.
But the contract will impact upon that is the issue. Right. The people who are sort of negotiating this contract, obviously we have doctors in the BMA, but we also have the government spokespeople. They haven't worked as doctors, they don't understand the pressures, and that concerns me.
Yeah. So you've got a number of issues, and a number of other junior doctors will also have their own issues. I want to ask this question later, but I already feel I need to ask it now. So how on earth is this going to be resolved? Because so many issues are being attached to this contract dispute.
If I could just make one point.
Yeah.
I just wonder why this contract has to be imposed now.
Okay.
Why can't we make a contract that we agree on?
The people who are sitting alongside Hugh Pym, our health editor. We've got Dr. Jeeves Widgers-Saria, who is on the Junior Doctors Committee at the British Medical Association. That's, as you know, the union for healthcare professionals. We've got Mike Wood, who's a Conservative MP for Dudley South. We've also got Professor Nina Modi, who is president of the Royal College of Paediatrics and Child Health. They're an organisation that supports the strikes. Welcome to you.
Yeah,
and we've got
sorry, Victoria.
Oh, sorry.
I'm
go on.
sorry. No.
Don't apologise.
We don't support the strikes, and we don't not support the strikes. We are here to support our members, and we're here to speak on behalf of children.
Thank you for correcting me. Andrew Holdenby, who is director of Reform, which is a centre-right think tank, and Hugh Pym, who I've already introduced. Mike Wood, just to say, as you'd expect, we invited Jeremy Hunt to come on the programme. He declined. We also asked for anybody from the Department of Health for an interview. They declined, as did the NHS Employers, which is the organisation responsible for delivering the new doctors' contract. The point raised by our junior doctor here, why does Jeremy Hunt have to impose this contract?
Well, I mean, obviously, we saw in the video clip these negotiations have been going on for 4 years now.
Is that a good enough reason to now impose it?
The question is, are these negotiations going any further forward? We thought we'd got a solution that was obviously co-authored between BMA, Department of Health, NHS Employers. The leaders of the Junior Doctor Committee described it as beneficial to our patients and beneficial to our junior doctors. They said that it addressed the questions over equalities, that it was an improvement on equalities. Now, of course, the new contract...
But then the members voted against it.
Absolutely. And I think the BMA have to look at how they've engaged their members in terms of representing and recognising what concerns were. But I think there's a wider problem with the amount of hysteria, really, that was being whipped up this time last year when junior doctors were being told that they were going to be losing 30–50% of their pay, which wasn't true then. It's certainly not true in the new contract on the ground.
You are representing, you're on the Junior Doctors Committee on the BMA. Deal with Mike Dudley's point. And other people have made the same criticism. You've led your members up to the top of a hill. You've had to march them back down again by caving in about the strikes next week. You've got people describing you as amateurish, erratic, one newspaper columnist and a Conservative peer describes you as today. You're not in control of the situation.
So Firstly, thank you so much for inviting me here today. It's a privilege to be here and to hear so many people's opinions on where we are and what's going on here. I think the first thing I want to do is just talk about the fact that, you know, we've been talking about, are you pro or against strike? I'd like to think all of us are against strike action. No one wants to leave hospital. If, you know, I'm a junior doctor first. At the end of the day, my patients are my priority.
You know,
I don't want to leave the
I'm
wards.
sorry to interrupt. I keep hearing you saying that, keep hearing you say that, and you keep going out on strike.
And this is part of the problem that we have, is that at the moment we have done everything short of this to this point. Throughout this process, we have been trying to find a solution. The problem we have is, unfortunately, the Secretary of State is not just not listening and not engaging in that process, but the problem we have now is he is forcing through plans that not just independent experts, not just the frontline staff in our hospitals, our junior doctors are saying are uncosted, untested and damaging. But even the government's...
You said this deal was all right.
So let's be clear.
So it's the same deal.
Let's be clear. The leader of the junior doctors, Johan Malawana, said that within the constraints that we had, in the 8 days that we had to try and negotiate in that time, under the new sort of criteria that were laid out with ACAS and with David Dalton, unfortunately, in that time, he felt we'd reached the best deal we could, but it was always subject to a referendum, because ultimately, junior doctors have to decide. They are the frontline staff, and we inform them so they could make an informed decision.
Professor Modi, do come in here, and then we'll bring in Andrew Holderby.
Thank you very much indeed. Victoria, if you'll forgive me for putting it like this, I think that it's unhelpful to polarise the debate into do you support strikes or do you not support strikes?
You know, because that's for simplicity purposes. I absolutely acknowledge that everybody watching around the country and many people in this room, it's not as simple as black and white. There are so many nuanced views, and we're hearing that this morning, hence 2 hours to discuss it.
Thank you for acknowledging that. But could I ask you, and indeed colleagues here, and indeed the audience, to join me in a little thought experiment? Let's, for argument's sake, say that the junior doctors' strike are not happening, have not happened. They don't exist. Let's wipe them off the face of history.
OK, I'll go with you on this, but do be brief.
OK. Well, in that case, where would we be with our health services today? We would be with acute provider trusts in about £2 million of deficit. We'd have £200 million, that was billion, the first figure, £1 million of public health cuts. We'd find GPs struggling to get sufficient training to look after children, the people for whom I speak. We have seen, just in this last fortnight, the suspension of paediatric A&E services. We've seen reports that from our national charity that show that 1,000 babies a year are being unnecessarily transferred between hospitals because of lack of capacity. We've seen a cut to HEE's budget.
And the relevance to the contract.
The relevance to the point I'm making is that were the junior doctors' dispute not to have happened, the NHS, Public Health England, Health Education England, everything that comprises both acute, preventive and community and general practice services would be in a very, very, very difficult situation indeed. So I suggest that if we are going to speak about healthcare, patient safety, public well-being, then we have to take all of these other considerations into account simultaneously.
All right. Hello.
Hello, Victoria. There is a wider health debate, but we're talking about the most extreme strikes in the history of the NHS, never been done before. There are detailed views about the contracts. The question is, should we go for the strikes to do it? I think it's a militant response. I don't think we should. I would predict that the strikes later this year will not happen because the BMA is losing support. It could not find the support to do this first strike of these 5. I would predict that public support will continue to fall and we will not have these further strikes.
Let me read some more messages from people around the country. Dr. Jeff O'Leary says, what I do not understand is if the contract was deemed to be OK in May by the BMA, why it seems to be unsafe now. Mike in Bristol, junior doctors are privileged, born with ability and opportunity, a wonderful future. Accept what is being offered now in exchange for secure and excellent pay. Caroline in Liverpool says, striking is dangerous, but expecting employees to have no way to protest means we end up being long-term dangerous rather than being fair and cooperative. We should back anyone's decision to protest as they do it when they're left with no other option. And Festus says this, It feels like we are all witnessing the destruction of the NHS by politicians who are trying to use doctors as pawns. I support those doctors. Hello.
Hello, my name's Richie and I'm an orthopaedic registrar and also a junior doctor of 10 years working in North East London. It's just a response really to Andrew and Mike Wood. So you've used words such as hysteria and militancy as well. I think it's very simplistic to consider the aspect of strikes in isolation without seeing what the alternative is. I absolutely don't want to strike. Striking is a last resort. Striking is a failure to listen, a failure to come to an agreement. But you have to consider what is the alternative if this contract goes ahead. I work as an orthopaedic registrar. I do operations, so I know what is required to safely staff a 7-day service. They are basically trying to stretch 5 days of non-emergencies into 7 with no extra funding, no extra staffing, no extra auxiliary staff, nurses, physiotherapists. So number one, it will lead to danger to patients. I'll tell you why. I'll give an example of a fracture clinic. 3 doctors, that myself and 2 others, cover 130 patients in 3 hours. We spend 3 minutes per patient. To cover those extra clinics on a weekend, you'll take one of those doctors away. So you'll have 2 doctors covering 130 patients in 3 hours. We get lucky at the moment. The system at the moment is in a state of where, if anything happens, if a doctor gets sick, if a patient gets sick, if a member of auxiliary staff gets sick, it collapses. And you are precipitating that collapse when your own risk register leaked 2 weeks ago, said a 5 out of 5 severity risk. This is understaffed. This is underfunded. And I have to go back to some of your polls that you mentioned as well. You said that public support is waning towards a strike. The ITV poll at the weekend showed there's an 85% support for this strike.
How does that compare with April? That was my point.
The poll of 127,400 members of the public, where they surveyed them, they said, do you think a 7-day service is a priority, a 7-day non-emergency service? Less than 3% thought it was a priority. They thought that improving the 5-day service was a priority. And the last point I would like to make is, the second thing, and a lot of people are not aware about this, is junior doctors do not have adequate whistleblowing protection in the new contract. And this is a massive point for me. Because at the moment, if I see a problem being done to my patients, harm, malpractice, I want to be able to report that safely so that I can actually improve the service and stop harm being done to patients. So you are putting doctors between a rock and a hard place. You are asking me to be complicit in driving through a contract which I know causes harm, which the government knows causes harm, and then you are saying, don't report if any harm actually occurs.
All
so
right,
you will lead to a culture of cover-up.
Just so everybody gets it. Mike Wood, Conservative MP, do respond directly to this gentleman.
I mean, there are very clear proposals and improvements on whistleblowers in terms of making sure that junior doctors are being protected equivalent to being employees of Health Education England, so they'll have the legal protection for whistleblowing. But in terms of the staffing, you mentioned, it's simply not true to say that we're trying to stretch a 5-day staff over a 7-day service. Obviously, there are 9,000 more doctors now than there were 6 years ago. We're training another 11,500 doctors as part of 80,000 more staff across the NHS.
There's a 20% less intake into medical schools this year. I believe that I'm actually in a little bit of an unfair advantage over you, Mr. Wood, because I've worked in the NHS for 10 years. So unfortunately, I do know what it takes to staff that. I do know what it takes to staff a weekend service, and I'm sorry, but that is not true.
Okay, so let me bring in Hugh Pym as a kind of independent arbiter. 5 days, we are going to talk about this further after 10 o'clock, but let's do it now. 5 days into 7 days. How does Jeremy Hunt see that is going to work?
Well, I think the problem with the 7-day NHS debate is all got very confused, because when the strikes happened earlier this year, it was very much about safety, it was very much about weekend pay, it was about whistleblowing and fining hospitals, and that is really the key bits of the contract. Now it's turned into a bit more of a debate about the 7-day NHS, and I think the link between the two in terms of what actually needs to be agreed in the contract is not entirely clear. But I would put a point to Mike Wood. Do you think Jeremy Hunt has confused the issue by trying to say the junior doctor's contract is irrevocably linked with the 7-day NHS when junior doctors already work at weekends? And that is sort of inflamed opinion. Wouldn't it have been better to have just focused on the contract and not got into this 7-day debate?
Well, I mean, I think they are linked. Of course, junior doctors, like other parts of the health service, work 7-day weeks. Of course, they work night shifts. But of course, the current structure on premium pay does act as the disincentive for NHS trusts in terms of how they're structuring their rotas. It means that the same level of support for emergency and urgent care isn't similar at weekends as it is during the week. I mean, anybody who's been in hospital at weekends or having to be admitted at night can see that, I mean, it is not equivalent.
Can I just ask, how are you going to do that if you haven't got enough doctors, consultants, registrars, etc., etc.? There is a shortage.
Yeah, I mean, in terms of, obviously, in terms of the funding that was raised, of course, when Simon Stevens, as head of NHS England, reviewed the pressures on the NHS, he said that the NHS would need another £8 billion in funding by the end of this Parliament.
But Mr. Wood,
so the government's committed to £10 billion above the rate of inflation, so above normal price increases, and that's what is funding the extra 80,000 people that we're aiming to recruit into the NHS.
I thought that was just to keep the NHS going as it is now by 2020.
Mr. Wood, you're openly admitting that there is a problem at weekends as we exist in the emergency service, that they are understaffed, and I agree with you. I think services like diagnostics, I think services like people waiting in A&Es, people waiting in fracture clinics, it is not acceptable at the moment. But how can you possibly do that by then taking extra funding and just not putting in any extra funding and adding 2 extra days of non-emergency services? You are just going to accentuate
for the answer to that question, because Hugh has actually done a film about the 7-day service, the ambition of the 7-day-a-week service, and here it is.
At the centre of the junior doctors' row is the government's plan to make the NHS in England a 7-day service by 2020, a key pledge in its manifesto and one that it believes it has a mandate to deliver.
With a future Conservative government, we would have a truly 7-day NHS.
The Conservatives envisage people having access to local GPs 7 days a week, and, crucial to this debate, patients receiving the same level of urgent and emergency care in hospitals in England at weekends as on Mondays to Fridays. Junior doctors already work at weekends and in fact represent the bulk of medical professionals on shift. Tweets directed at the Health Secretary using the hashtag #ImInWorkJeremy were keen to prove this point. But while emergency care is available at weekends, staffing levels are much lower. And under the current junior doctors' contracts, ministers say it would be too expensive for hospitals to roster the same number as on weekdays. Then there's the controversy caused by Health Secretary Jeremy Hunt's suggestion that a lack of staff is increasing the weekend death rate. One report he cites using hospital data from 2013 to 14 indicates that a patient is 15% more likely to die within 30 days if they're admitted on a Sunday than on a Wednesday. The British Medical Journal, however, which published the findings, believes the data has been misinterpreted. It says there are other factors that must be considered, such as how patients admitted at weekends tend to be sicker than those admitted during the week, and that there's no evidence to suggest extra staff would prevent so-called excess deaths. If the government gets its way, however, medics believe they'd have to work more weekends. But whether this will lead to a truly 7-day NHS is unclear. Leaked Department of Health documents revealed in August that civil servants worry that a lack of available GPs, hospital consultants and other health professionals would mean the full vision could not be delivered. Government sources said this was a normal risk assessment.
So let's find out more from our audience about this ambition for a 7-day-a-week NHS. We have an audience here of junior doctors, of other NHS healthcare professionals, of patients, taxpayers, voters. Yes, hello.
Hi, Victoria. My name is Zishan, and like Alex, Professor Modi, I'm a children's doctor. But I just want to bring in a point about my personal experience of the NHS. So my dad passed away recently, and there were a series of mistakes in his management that contributed to that. The last of which was when withdrawing care, his pain medication was messed up, meaning that his last moments were him screaming out in pain. That wasn't on a Saturday, it wasn't on a Sunday, it wasn't on a strike day, it was in the middle of the day during the week. And Jeremy Hunt is ramroding through a contract on the premise of a 7-day NHS with no extra funding, no extra employment, no actual plan as to how it's going to work, and criticism from his own department. He's going to end up taking staff away from the days that my dad wasn't being able to be looked after, understaffed and underfunded days, putting them onto a weekend with no actual evidence to say that it's going to work. Even the papers that he's quoting for the 7-day NHS statistics have said things like it's rash and misleading to say that employee increase is going to help. And that's not not something I'm going to stand for. It's something I'm going to fight for because I want to protect the NHS and I want the NHS to be something we can be really proud of.
And is it right to fight for what you believe in through this contract dispute?
I think ultimately, as a paediatrician, as a British citizen, I want to do what's best for patients because I look after vulnerable children. And at the moment, I'm on 13-hour shifts where I don't get breaks and I'm looking after sick children the whole time.
This is on your current contract?
Oh, that's on my current contract.
Right.
I fall asleep at the end in my car and have to get a taxi home. And yet a few hours earlier, I'm making decisions on how to manage a 6-year-old child who's not breathing. The contract won't make things better or make things worse, not just for the patients, but also for the doctors and for the general public.
OK. Hi. On the 7-day-a-week ambition, what are your thoughts? Do introduce yourself. Hello.
My name is Ashwin. I'm one of the orthopedic surgeons. We do work 7 days a week. This weekend, I was on call for 48 hours. There was a registrar on site. There was an SHO on site. And I've seen every patient that has come through the door. If at this, we are struggling as we stand to fund that. And just to give a small snapshot, we are struggling for getting junior doctors to cover night shifts. And the whole system is entirely based on the goodwill of the junior doctors. And we as consultants wouldn't be able to do what we do if we didn't have the goodwill of the junior doctors.
OK, let me read this message from Paige, who texts, I work shifts like millions of people. Our shifts are 24/7, 365 days a year. A few years ago, our son broke his ankle and had to wait 3 days over a weekend before it was operated on. I've no support for doctors. Leaving people in pain so they can enjoy their weekends, ? Join the rest of us and work nights and weekends. We don't get special treatment, so why should doctors?
I'll come back exactly that point. So, on the weekend, it is not only me. It has to be an anaesthetic staff. There has to be a team. Has to be a team. Has to be an MRI support. Has to be an X-ray support. So most hospitals operate on the weekends. I operated on the weekends, both days, Saturdays and Sundays. What we prioritized there was elderly people who have broken their hips and kids. Obviously, ankle fractures probably have to wait till Monday.
Right.
And
so because just to be clear to Paige, for example, because there aren't enough of you, enough in that team to do that op, then you prioritise the very, very vulnerable, and somebody like this little boy would wait till Monday.
So for one operation...
And your question now is, how can we continue to do this when there aren't more people coming through, or the money to pay for
So it's a simple...
Okay. Sorry, I just want to get some more people in, but thank you very much. Hi.
Hi, I'm Richard Short. I represent the Conservative Workers and Trade Unionists, but also I'm a patient. And I heard our friend earlier saying he's worked for 10 years in the NHS. Well, I've been involved for 46 years with the NHS as a patient. And the 7-day NHS is absolutely essential for our modern way of life. My day job, I work in hospitality. My son is an actor. My daughter works in retail. There are so many walks of life where 24-hour, 7-day working is the norm.
And if there aren't enough people to do that,
need to catch up.
If there aren't enough people, as many junior doctors you've heard this morning say, there aren't enough of us to do this effectively / safely at the weekend. What do you say?
Well, I'd say look at your contract again, the contract that the BMA agreed with back in May, because the reorganisation is being done to make sure that that cover is available. Extra funding is available, despite the calls from the BMA.
OK. Thank you, Richard. Hello. Morning, sir.
Hi, I'm Dr. Bob Gill. I'm a GP. I also train junior doctors, and I'm starting to produce a film called The Great NHS Heist. What we are...
A film?
A film called The Great NHS Heist.
I heard it the first time.
OK.
Good. 2 plugs there.
The junior doctors dispute has to be seen in the wider context of NHS privatisation.
What you mean by privatisation?
Privatisation...
It is free at the point of delivery and will continue to be according to a promise by the Conservatives.
Well, we had the 2012 Act, which allows hospitals to generate up to 50% of their income from private patients. We have Simon Stevens' 5-year forward view, which spells out the closure of 17,000 hospital beds, and also alludes to the de-skilling of hospital staff.
And why do you say, sorry to interrupt, that this contract is relevant to what you believe in terms of future privatisation of the NHS?
There's no more money we will be the only developed country in the world that is offering routine care 7 days a week. It is designed to drive doctors out of the system. That's a deliberate intention of this contract.
What?
Okay, because what will happen is you'll have a staffing crisis, you'll have justification to
So hang
close
on, just
more.
let me get. So you're saying that the Health Secretary, England's Health Secretary,
Yes.
deliberately wants to drive doctors out of Britain
That's
to
right.
collapse the NHS effectively to enable more private providers to come in.
Well, we've already seen.
Does anyone think that's is that reasonable? Okay, a number of people
Well,
do.
can
okay.
I expand on that? We've seen.
Can I just ask Hugh Pym, our health editor, to just come in on that point? A number of people have made this point about privatisation and putting it together with this contract issue. What's your take on this?
I don't see any link between this contract and privatisation. Of course, privatisation is a very it's a loaded term. Do we mean selling off shares in the NHS like British Gas all those years ago, or do we mean use of private providers?
Yeah,
so
that's
that's
what-
never been made clear. The use of private providers with NHS money was running at about 6%, it's now up to about 7%. Now, for some people, that means 93% is still NHS. For others, the 6 to 7% is significant. And it remains a big debate around the health service. But linking it with the contract, I think, is very much a value judgment by some. And I think if you talk to a whole range of junior doctors, I don't think they'd say privatisation was their main motivation in this debate.
Hello.
Hi, I'm Simon Preet. I'm a student at Newcastle. This is directed to you, Mike. You're a Conservative MP. We've elected you. You're not giving, you haven't once said where you're going forward. We've elected you. I'm not talking medically. I'm just a student. I'm not a med student. But you're not giving these professionals who take care of us every day a straight answer. So I'm going to ask you, as a member of public, you're our MP. What's next? What are you actually going to do? You can't dismantle the NHS. What's forward? How are you going to do this?
Do you mean resolve the dispute, do you mean?
Yeah, I'm against strikes. I don't think the strike should happen. So firstly, stop pushing these poor professionals to a strike. And secondly, how are you going to, they don't want a new contract, so what are you going to do?
OK, I'm going to pause for you to answer that question after the news and sport, which is coming away. And we will get back for Mike Wood to answer your question directly. Don't worry about that. Let me read you this message from one viewer who wishes to remain anonymous. I'm disabled. I often use the NHS. I support junior doctors. Money has been wasted by the changes to the NHS over the last few years. For example, in my area, they have subcontracted out the ambulance service, and the cost of this is enormous, and it still doesn't work efficiently. I'm often sent an ambulance to take me to my appointment, and I'm the only person in it. Do keep your views coming in. If you want to get in touch, you're very welcome wherever you are in the country. Use the hashtag #VictoriaLive. This morning, we have been talking about the long-running row over that contract for junior doctors, which has so far this year led to 162 hours of strike action, including junior doctors withdrawing emergency care. Let's hear some more from patients in the next few minutes. We've got a number of them in the audience, as you would expect. Good morning. Hello.
Morning. Hi. My name's Sarah. I was diagnosed with breast cancer a couple of years ago, so I have a lot of experience of the NHS, not necessarily through good reasons. And what I'd really like to talk about is how, when I was first diagnosed, my oncology, if you like, and all the treatment I had for my cancer was clockwork, it was precision, everything. I felt incredibly safe. I felt really well looked after. And I would like to say a big thank you to all the NHS staff for saving my life, bless you. Very grateful. Subsequently, I've had a lot of post-treatment things that have led me to access the NHS via A&E. Most notably, probably cellulitis in my arm, which led to me getting sepsis as well. So it's quite an urgent case. Wow. And I saw people in A&E who I saw during my time as a cancer patient, and they were within an inch of their life, spread to, thousands of people, it seemed like. I was lying in a bed really poorly, and everyone was doing everything they could to help, but it was just chaos.
So you are hugely grateful to the NHS, and you also have huge sympathy for what you see as overstretched staff.
Absolutely.
Do you support doctors striking for 5 days at a time over the next few months?
I do, because I think that to take such action, I really believe these people. I know them intimately. I don't believe that they'd be doing this unless they absolutely had to. I personally have got a lot of experience. I'm now a campaigner for the NHS, and I speak
Don't you worry about safety to patients in those 5 days? I mean, that's why next week's was called off, because it was too short notice, said various regulators and others. And the GMC saying, look, this could be harmful.
Yes and no, but I really believe that I think the seniors are going to come out and support them. I am in contact with a lot of medical people at a senior level who I've talked to in depth about this. I'm no politician. I don't know the nuances of the contract, but I know that I would trust what I'm hearing from senior people within the senior doctors, registrars, consultants. They're fully behind their junior doctors, and I believe that they will support the junior doctors during that period. Of course there's going to be operations cancelled. I don't believe they'd be doing this unless they absolutely had to. I fully support them.
All right. Dr. Jeeves Widger-Saria is here. He's on the Junior Doctors Committee at the BMA. You wanted to come in there?
Yes. Thank you so much for your story, and thank you so much for your support. I hope you know that we really appreciate it. One of the things I just wanted to talk about, we talked briefly about patient safety, and we talked about the recent set of strikes being suspended. Firstly, I want to say that the reason that's happened is because patient safety remains our priority. Our goal is not an industrial action. Our goal is a negotiated settlement. The reality is, when we set out these plans, we gave the notice period that is required. But ultimately, we have a major incident protocol, a major accident an escalation protocol that we've set up with NHS employers and trusts for that precise reason, so that if trusts are struggling to provide the coverage during that period of time, of course we are going to step back, because that is a priority for us.
So you could step back from the 5-day strike in October, November and December then? Over patient safety concerns?
If there is a concern about patient safety during that time raised by trust, we have a process for that. But what we know from the steps that we've taken and the action that we've taken so far is our consultant colleagues are there with us, our senior doctor colleagues are there with us, our associated specialists, our other professionals working in hospitals, pharmacists, nurses, etc., have been there to cover the service. Junior doctors will spend this month working with their colleagues to ensure that the coverage during that time is adequate, that LISA covers, etc.
But it's interesting to hear you say if those concerns about patient safety are raised again, you will step back again.
We have a process for that. I think the really important thing is the best case scenarios, we have a month to stop this happening in the first place. We have a month for Jeremy Hunt. We have a month for Jeremy Hunt to say, you know what? The BMA have listened to experts and professionals, and they've put patient safety first. Surely it's time for me to do the same and say that I'm not going to impose a contract that actually makes a lot of the problems that we already have with services overstretched and without enough staff even worse.
OK, over here. Hello. Hi.
Good morning.
Good morning.
Hi, my name is Faye. I'm a patient in the NHS. I'm currently undergoing care, and I'm waiting for more tests and possible treatment. And I know that if industrial action does take place, then my care could be disrupted, and I'm really very worried. I've been waiting a long time for the test that I need to have, and this could make it even longer. However, I have listened to what junior doctors have had to say, and when I speak to my doctor who recommends treatment for me, there's always risks with the treatment. So they always say, well, if you take this medicine, then there could be these complications, but we think that it's right for you to take it because the benefits outweigh the risks. And doctors make those decisions every day for us. We trust them to make those decisions. They're trained to make those decisions, to do risk analysis. And I hear that what the doctors have done now is that they've said to us very clearly, we've done a risk analysis, and the imposition of this contract is more dangerous for you, for your health, for my health. It's more dangerous for my health for this contract to be imposed than for me to have a delay in my treatment due to the strike.
Okay, and when you I mean, I can hear the anxiety in your voice about waiting for those test results and that further treatment. When you explain to your consultant that, yeah, despite that, you're supporting the junior doctors in their action, what is the response from medical staff?
They're happy that I support them, that I trust them as professionals who have been trained to care for me and my family and the health of everyone in this country. Okay. And they're happy that I'm trusting them to tell me what the right thing for my health and all of our health is.
Okay. Thank you. Hello.
Hello, Victoria. Thank you for inviting me to be here today, Victoria. My name's Paul Buchanan, and I'm a patient advocate and run an organisation called Team Blood Glucose, which runs an online peer support group for people with diabetes. And tens of thousands of people all over the world take part in our peer support activities. And whilst I understand the plight of the junior doctors, I simply cannot support 5-day strike or strike action by doctors and by the NHS. I completely understand their position and are totally supportive of the issues, and the fundamental issues appear to be much more about resource constraints within the NHS and trying to deliver a 7-day service with 5 days worth of money, and trying to deliver a system that was built at a time when the budgets and the institutions which are still delivering it were fit for purpose.
Okay, I'm just going to call on any junior doctor here to talk to Paul about this. I need a microphone. Let's have a junior doctor. Janice, would you pass this microphone forwards? Janice, Paul, Janice, junior doctor.
Hi, Janice.
And a gentleman who runs it online.
At the same time, I would say I completely disagree with the government's stance on this. And not only has Jeremy Hunt lost the confidence of the doctors, but I believe if you were to do a poll of patients, he does not have the support of patients either. So, frankly, who is he representing here? Right. The issue that's been raised about patient safety, though, is the thing that's paramount to me. As somebody with a lifelong chronic condition, I'm reliant upon the NHS for the rest of my life. So I'm not just a dip-in, dip-out acute patient that uses it in emergencies as well.
Paul, would you say to Janice and colleagues, bearing in mind, I know you're unsure about these 5-day strikes. You were supporting earlier in the year, and now things have changed with you. You would say to Janice and colleagues, don't do it, or what?
Well, definitely not. I mean, I would like to ask the question of the BMA as well as the government. Both sides are claiming that this is about patient safety. Where's the patient voice? In none of this debate for the last 2 years has any panel of patients been brought together representing any area of patient concern. What we do have are professionals on both sides of the fence pointing fingers at each other, and it's boiled down to a dispute over contract terms and conditions, and has now been raised and escalated into one of patient safety.
Okay.
Who did the BMA talk to? Which patient groups? The government clearly haven't spoken to a single patient organisation.
All right, well, as the representative
when
of
do
the
the
BMA
patients get a voice in this?
Quick response, please, and then I'll bring in more.
Look, I absolutely agree with you. I think that's something important, and it needs to be part of what we do going forwards.
But you haven't so far. Why not?
So
is the question.
This has been a contract dispute between ourselves and the people looking to impose that contract.
Okay, that's the answer. Thank you.
Okay.
I know you want to come in, Andrew. I'm sorry, I'm being brief because we're galloping towards the end of the programme, but go on.
Well, just that I think what we've heard today is that there's a lot of issues. There's a contract dispute, there's many other issues. The question remains, should we put the NHS through the biggest strike in its history about those contract issues? It just doesn't seem to me that's the right response.
All right.
I would respectfully ask, and I think I probably have the support from most of the people in this room, for our current Health Secretary to resign. I totally agree with... sorry, I can't recall your name. Paul. I totally agree that whilst I fully comprehend that it is between the junior doctors, the government, etc., I do get that. But I think if we could get a patient voice in there from the people who are experiencing a really challenged NHS, we'd probably keep the support for the junior doctors, and hopefully they wouldn't have to strike.
Okay.
Isn't this a chance for the government, with the new Prime Minister, to actually grab this by the horns and do something substantive to review the NHS, to actually review what we mean about healthcare delivery for a millennial generation and reframe this debate about the needs of patients for the next 100 years, not just the needs of junior doctors for the next 10
Mike
in a contract.
He's a Conservative MP, and then I'm going to go to the gentleman next to you. Do you respond?
Well, I think the point you raise about the need to engage patients is an important one, and I do think that...
Well, you haven't done it. Mr. Hunt hasn't done it.
I don't work for the Department of Health to talk about what consultations have happened, but obviously what we did do is, as Hugh referred earlier, last year's general election, the Conservative manifesto clearly committed us to introducing that 7-day NHS, talked about the service. This wasn't something hidden away towards the back. This was just line one of page one of our manifesto, not about economy or about Europe. Now, I don't believe that the junior doctors on the BMA would have recommended a deal in May that they thought was going to damage patient safety. And it's because it doesn't. It quite simply doesn't. It reduces maximum working hours. It restricts the number of night shifts. It restricts the number of long shifts. This will make things safer for patients, as Dr. Ellen McCord said in May it would, and that remains the case.
Hi. Can I just clarify a misconception that's been repeated several times today? Yes, there was a point at which Johan Malawana said, within the confines of what we've done, we believe we've made progress here. The Junior Doctors Committee, the people that represent the junior doctors, did not give a view. In fact, they said that they would stay neutral. Why? Because the decision was always going to be that of junior doctors, who were then informed to make that educated decision.
All right, thank you. Hello. Hi.
Hi there, my name's Dominic Stenning. I'm a patient, but I work a lot with NHS and third sector. You know, look, I find this debate has become very, very polarised, and I was very supportive of the junior doctors and signed the petition for it to go to government earlier on in the year. But I'm very, very uncomfortable with this 5 consecutive days of 50,000 doctors withdrawing their services. You know, my dad was a GP, and he was diagnosed with cancer and died 3 months later from his diagnosis. You know, these, you know, yeah.
You think the 5-day plan is disproportionate?
Yeah, disproportionate.
Okay.
That's what I'm worried about, because, you know, you've got people waiting for really important results. What worries me is we covered earlier on in the debate very well, you know, trying to nail down what are these real key issues in this contract. And then it worries me that when we start moving the debate about other things, you know, other than resolving that, we need to move this forward. And in order to move it forwards, we need to get patients in the room.
Okay.
You know, and so it focuses people's minds, you know, government and the BMA. And we're still waiting for the BMA and Jeremy Hunt to answer our open letter that we all signed, a group of patients, you know, because we want to see an end to this. You know, the NHS is already crippled, as this gentleman said very well earlier.
We're definitely going to talk about how people here think this dispute might be resolved. Before that, though, we've talked about the 5-day strikes that are due in October, November, December. Here are the contingency plans that are in place for those strikes if they go ahead. Here's Hugh Pym.
A 5-day strike has never happened before, but across the 3 planned this year in England, the government calculates that 75,000 operations and 750,000 hospital appointments could be postponed as a result, with non-emergency surgery, such as hip replacements and back operations, worst affected. This could mean an increasing number of people fail to have their routine operation within 18 weeks, causing them further discomfort and placing added pressure on an NHS target that's already being missed. Hospitals have, however, been ordered to ensure that most essential services such as A&E and maternity wards are well staffed during strikes. They've been told to draft in consultants and other senior doctors in place of the junior doctors. These services reportedly ran smoothly in the last set of strikes, but there have been concerns that with the NHS traditionally being stretched over the winter months, the next 3 strikes could add further pressure. Striking doctors, however, will return to work if their employers become concerned for patient safety, an option not used in the last set of strikes.
And of course, the dispute over the contract is an England-only issue. Scotland and Wales have both said they will be sticking to their existing contracts, while Northern Ireland has yet to make a decision. With us throughout the programme today, Dr. Jeeves Widger-Saria, who is on the Junior Doctors Committee at the British Medical Association, that's the Union for Healthcare Professionals. Also with us, we have Mike Wood, Conservative MP for Dudley South. Also here today, we have Professor Nina Modi, who is President of the Royal College of Paediatrics and Child Health, and Andrew Holdenby, who is Director of Reform, a centre-right think tank, and our health editor, Hugh Pym. Lots of patients wondering if the contingency plans in place for strikes in October, November, December are good enough, will protect them. What would you say as a junior doctor?
So as a junior doctor, having participated in the previous a 9 to 5 emergency walkout, during which my service was covered by my consultants who stepped in to support us in our strike action. They provided an excellent service for the children who were sick in my hospital during that time.
And over 5 days, can the same be done?
I wasn't confident that it could have been done next week, but I think with more planning it could be.
Okay.
And it's worth making the point that in the last set of emergency walkout, there was not one single clinical incident reported in the whole country where patients were put at risk. So when you hear about people making the accusation that we're being dangerous, it's a myth.
Well, we don't know over 5 days, to be fair, do we?
So we have a responsibility. We're doctors working for the GMC, and we have a duty of care for patients even when we're striking, and we have to be confident that our seniors are going to support us.
Yeah.
And if they are, then we...
If it happened, sorry to interrupt, if it happened that you happened to be on a picket line during that 5 days and one of your colleagues, senior colleagues, ran out and said, actually, we need you now.
We would go in.
Fine.
Of course we would.
Professor, hello.
Victoria, I have to bring you back to the point that the NHS, as it currently stands, is not safe.
People argue about that, so go ahead.
Well, I say I don't want to bore you with statistics, but as I say, 2 children's A&E services have had to close recently. We've had, as I say, 1,000 babies transferred because of lack of capacity. We've had further cuts to the ability of Health Education England to commission more training places, which means there will be an even greater fall in junior doctor numbers. We have a current shortage of 1,000 paediatric consultants. We've had cuts to Public Health England. We have an increasing burden of chronic diseases in children. The NHS is creaking at the seams. It is not safe at the moment. It is really, really tragic that it's taken strikes which no one wants to draw attention to this. But at the very least, let's say that if the public debate ensues which addresses the current shortfalls, the current deficiencies, the current lack of patient safety within the NHS,
So
that at least will be a very good thing.
Right, so the contract dispute and some of the specifics that we heard earlier is useful, you think, as a way of drawing in other issues to discuss?
I would not wish to have had it happen this way.
Of course not, of course not. But now we are where we are.
But now that we're where we are, it has been heartwarming to hear from colleagues in this room, particularly our patient colleagues, about what it really means to be a patient in the NHS today.
Thank you. Hi.
Hi, I'm Tito. Something I just wanted to mention is that when we're talking about public sympathy, the public is always going to be on the side of the doctors. These are people who have dedicated their lives to the service of humanity and making sure that we live as comfortably as possible. In my family, me and my sister play sports quite regularly, so we always have injuries and scrapes and bruises, as everyone does. And each time I've gone to the hospital, I've had a wonderful treatment and I've come back home safe and sound. I don't like the idea that doctors are being pushed to the limit of their safe procedures. And as a person that uses the NHS frequently and as a normal person, this is just terrible to imagine.
Okay.
And I hope Jeremy Hunt really has a serious think about what he's doing as the Minister of Health.
Let me read some more messages from people watching and listening to you around the country. Ali in Liverpool says, I'm due to be going into hospital for a hip replacement very soon. In fact, the 6th hip replacement in 5 years. Wow, Ali, I hope you're all right. I'm sitting here with a fractured femur watching your programme. I'm in great pain, but even sitting here in great pain, I 100% support the junior doctors. This texter who doesn't leave their name, why do doctors have the right to pick and choose what shifts they wish to work? No other emergency services have that right. We require 365-day, 24-hour working by the well-paid professionals called junior doctors. They knew what they were signing up for when they decided to join the profession. Jenny in Maidstone, last September, I had 4 discs prolapse from my neck right down to my lower spine. I couldn't walk, drive, shower, or leave the house. I'm 35. I had to wait until January the 3rd to have an MRIU, which eventually took place in a private hospital as the NHS couldn't provide the service. I had to wait to see the consultant specialist. It's been nearly a year now, and I've absolutely no intervention other than pain medication. I have no life. Fix the 5-day service, fund a 5-day service, and focus on providing an outstanding 5-day service. Junior doctors, I fully support you, but I think you've got that already, hadn't you? In the next half hour, we're going to look at how this dispute can be resolved. We're also going to talk about pay. It's the one thing that is conspicuous by its absence in this conversation so far this morning. We have a number of people in the room today, some of whom are junior doctors, some of whom are patients, some of whom are both. We've got voters, we've got taxpayers, we've got people who are with passionate views about the junior doctors' contract dispute and the forthcoming strikes. You know the one next week's been called off. 5-day strikes are due in October, November and December. But as the BMA Junior Doctors Committee representative has told us this morning, look, they could also be cancelled once your process has been gone through, if I understood you correctly.
Processes.
I understood you. I did.
Coverage.
Yeah, I understood. Okay. Anonymous text. I'm watching from my hospital bed. I was admitted on Sunday with a high temperature. I have non-Hodgkin lymphoma, and I can't fault my treatment over the last 8 years. I'm really concerned about Jeremy Hunt's motives, and I feel he's using the junior doctors as pawns in his long-term plans for the NHS. Chris says this. As a former soldier, Chris says this, as a former soldier, I'm disgusted in the junior doctors' willingness to hold the country to ransom. It's the armed forces that have covered the backs of those that have gone on strike in the past, i.e. firemen, etc. We can't strike, and we get paid only a small fraction of the salaries of those that do. You're losing support for your cause now. It's time to enact your oath and your obligations to your public. Let's talk with our health editor, Hugh Pym, about pay. I read the junior doctor's draft contract. It's very long, lots of it I didn't understand. I did understand that there is a basic pay rise of 10 to 11%. And if you end up working one weekend in 2, you will get 10% of your basic salary as a supplement. And if you work 1 in 4, it reduces. Is that accurate?
Victoria, I commend you for reading the contract. It's a highly complex document. You've possibly read more of it than I have. But the essence of it is, and this is what this debate and this dispute has been largely about, is how you reward doctors financially for working very unsocial hours and lots of different weekends. And what's been the aim of the government is to raise basic pay by about 11%, and in return you cut the extra that was being paid out for working on social hours. And I think the BMA accepted that it was worth looking at all this because it had become so horrendously complicated. But the deal that was reached, and it remains pretty complicated, clearly 58% of doctors out there didn't feel that it met their concerns. Now some people out there are saying, well, we work at weekends, we don't get paid extra. What doctors would say is, well, they work a lot of unsocial hours, and why do they have to sacrifice something financially? Because there may be some at the margins who lose out short term when we work so incredibly hard. And the bigger picture is this business of recruitment and retention. Do you risk losing doctors longer term if you don't get that balance right at this precise moment in time?
Okay. Hands shot up then. Let's just pass that microphone over here. Hi. Hi.
Hi, how are you? My name's Marie, I'm a senior nurse. I've supported junior doctors through all the industrial action last year and will continue to support them. What I've found throughout is doctors are really reluctant to complain about being poorly paid. They're really reluctant to ask for more money.
Are they poorly paid, do you believe?
I'm not saying they're poorly paid, but they're not well paid, and they're in no way on par with their colleagues in the city. Like a few years ago, we had, we have to give the bankers their bonus because we don't want to lose the expertise. So we're happy to hemorrhage our good doctors, our well-trained doctors out of this country. I think it's an absolute disgrace. And can I just say as well, wasn't it just in the last few years that MPs had an 11% pay rise each year consecutively, while we nurses and doctors have actually had pay cuts because we haven't even had the percentage with inflation. So I think it really doubles standards.
Can I ask our representative here from the Junior Doctors Committee on the BMA? It's a basic pay rise of 10 to 11%, and this, if you work 1 in 2 weekends, 10% of your basic salary on top. Let's just talk about percentage terms. I know there are 100 other issues. What increase do you think would satisfy your members?
So, firstly, when we're talking about an increase, it is one way of looking at it. The problem that we have is...
Please, just answer the question, and then you can tell us all the problems.
I promise, this does answer the question.
Okay.
ultimately, what we have right now, and we've talked about today, is that we have a huge staffing problem. We have services that are already, in 1 in 7 trusts, closing down services or cutting them short because we don't have the staff to provide them. The areas we're seeing that the most in, people like emergency services, our children's doctors, etc. These are the groups that work the most antisocial hours. What these changes mask, actually, is the people that do work those most antisocial hours are the ones that actually see a decrease in pay.
Okay.
They
And
don't see
and
that
that brings
increase.
you back to my question.
And that worsens the recruitment crisis. And what is absolutely counterintuitive is Mr. Hunt's been talking about a 7-day service.
I'm going to bring you back right now.
Yeah.
So what percentage increase would satisfy your colleagues, do you believe?
Well, I think we need to talk about the distribution. We need to change
No,
that percentage
I'm
increase.
asking you
at
a
the
really
weekend.
sensible,
I'm sorry, I can't give you an exact percentage because we need to look at those specific areas and we need to speak to the government about how they intend to fund and resource. The problem we have is that Jeremy Hunt has still not produced a plan for this 7-day service. We have not seen the specifics. And without that, something we've asked for over a year, we are all talking about a plan that no one has seen.
There's a man here from a think tank who is rubbing his chin with a wry smile on his face. Explain why, Andrew Holderby.
It's more that my jaw's hit the floor. We've been in a pay dispute for 2 years. We've had change of positions on all sides. One side of the dispute can't even tell us what they would like to settle the dispute.
Okay,
Where are we as a country?
Let me ask some other junior doctors then. Can you, all I want is a percentage, a figure that you think would be acceptable in terms of either the basic pay going up or the supplements for weekend working. Can you give me a percentage figure?
No, because it's not about percentage.
Okay.
To keep the same salary that I have. I'm quite happy with my salary. I don't want a pay cut. I don't want a pay rise. I just want to stay the same. I want to know.
So therefore, what percentage increase would you need with this new contract to bring it back to what you say you have now?
So I get my basic salary of £36,000 plus a 50% banding. So whatever it is that the BMA or the Department of Health need to calculate to make sure that I get the same take-home pay.
But some sort of increase in order to match what you say you get now. Yeah. Okay. Can you give me a percentage increase?
Whatever we have now. Just leave us alone, Jeremy. Give us the same contract that we've got already.
Okay. Swing round some more, if I may.
Could I also say that with the new contract, without the pay protection that is being put in place, I would take an absolute pay cut from the new contract for the same hours that I'm doing now.
By what percentage cut?
I think
if you got that protection.
I think it's about £300 a month.
Okay. I know you don't like the question. I know. I can tell you don't like the question. So respond. Go ahead.
So. Sorry,
do you not think it's a legitimate question?
It is a legitimate question when you think about pay in general and giving a really simple answer. I'm an A&E trainee, I'm an A&E doctor. There is something called a flexible pay premium, which the government have had to put in place to ensure that I, as an A&E trainee, who work all day, every night, 2 weekends every month, 1 and 2 weekends, the flexible pay premium that can be taken away by the government whenever it wants, just to ensure that I get paid the same as every other doctor working in the NHS. That's not right. That disincentivises people from working in acute specialties. They're the ones that don't have any doctors left. I constantly get emails every day about filling in for rota gaps. Okay, that's what we need.
Okay, I'm just going to pass this mic over here. Do introduce yourself as a trainee medic. So hello, and if this contract is brought in, what do you believe will happen?
So hi Victoria, thank you. My name's Adnan, I'm a medical student, I'm a final year medical student.
Final year?
That's right, yeah.
Okay, so how do you feel about going into a profession when this is going on?
Very worried, and I can tell you my colleagues are very concerned as well. And already we can see that the amount of medical students that are coming into medical schools has dropped by 20%. And it's not just...
we don't know if that's related to the contract dispute,
I think a lot of it is to do with the new contract. And as the professor was saying earlier, that already there's a shortage of doctors. And if this contract is making less prospective medical students join the field, I think that's really dangerous. And already I can tell you a lot of the medical students are sitting exams to go to America, to go to Australia perhaps, or even Canada. And if you think that, doctors are paid well here. You should see, well, they're not. That's not the case. And
some people think doctors are paid really well compared to what they earn.
23,000 pounds
That's the starting salary. Yeah, that's the basic. Okay. All right. Thank you. We're going to talk in a moment or two about how people here think this dispute can be resolved, if indeed they think it can be. I mean, it's got to be resolved at some point. In the meantime, demand on the health service across the UK is rising, so are costs, which is why the stakes in the ongoing dispute couldn't be higher. Here's Hugh again.
The latest dispute between junior doctors and the government comes at a difficult time for the NHS in England. NHS England needs to find £22 billion in annual efficiency savings by 2020-21. That's a huge task in itself. Added to that, ministers want to extend services at weekends, which puts pressure on the existing challenges already facing the NHS, not just in England, but across the country. They include Brexit. After the vote in June, health leaders warned that leaving the EU could make staffing shortages worse. The NHS Confederation says 10% of NHS doctors come from the EU. The ageing population. People are living longer, putting further pressure on the service. The growing number of elderly people means more patients with multiple conditions. Up to 2/3 of hospital beds are now estimated to be occupied by the over 65s at any one time. Advances in technology. Changes in what can and can't be done medically has revolutionised care, but it comes at a cost. Treating survivors of medical conditions that in the past might have killed them requires extra money. Paying for progress in medical technology costs the NHS increasing amounts every year. Lifestyles. People may be smoking less, but they're drinking more and putting on weight. The bill for dealing with alcohol abuse is around £3 billion a year. Despite campaigns to get people to live healthier, the number of obese people in Britain could double in the next 40 years. So demand on the health service across the UK is rising, and so are the costs, which is why the stakes in the ongoing dispute with the junior doctors couldn't be higher.
Hugh Pym, as you probably know by now. OK, so let's hear from more in our audience. We're definitely going to spend the last few minutes talking about how this dispute will get resolved. But first, you wanted to make a point. Hello.
Yeah, hi, I'm Adina. I'm a third-year medical student. I just wanted to say that having been in medical school for 3 years, my degree in total is going to be for 6 years. I just think this contract makes me incredibly sad that I won't actually be doing what I love, I don't think.
Why not?
Purely because it's making me think about either leaving medicine or going to a different country. And it saddens me because I really value the NHS. I wasn't born here, but I think coming to England and like this wonderful NHS and everything, it actually really works, and I just think I won't be able to be part of it. I don't want to sign, I don't want this contract to be imposed, and I'm not happy with it.
OK. Let's talk about how this dispute, how people here, with the experience they have, think this dispute can be resolved. Good morning.
Morning. Sue Richards. I'm from a campaigning organisation called Keep Our NHS Public, which has local branches all over the country. I wanted to say that in 2007, our health service was funded as the same proportion of GDP as other European countries, and it's been steadily falling since then. 1% of GDP amounts to £20 billion. If we were funded at the same level as France, we'd have 40 billion more, Germany 60 billion more per year. Now, that's been taken out of the budget so far by cutting the wages of NHS staff, not just junior doctors, but all the rest, keeping them down to below levels of inflation. But we've used up that capacity now. They've been cut to the limit. And what's coming next are big cuts in services, and are going to be announced in the autumn. And I think Jeremy Hunt is using junior doctors as a human shield to protect him against the political flak that's going to fly as soon as people know that their local A&E is going to be closed, that their local maternity ward is going to be closed, and they're going to have to travel much further to get treatment.
OK, we'll see what happens in the autumn. Can this be resolved? Hello, do introduce yourself.
Hi, I'm Henry. I'm a freelance journalist. I want to look at resolution in two ways. In the short term, I think that it's very difficult if you assess the strike as a strategy to see how it can work, because by increasing the NHS is political. Jeremy Hunt can't back off. It is government run, and by increasing the political pressure on the government, you actually you give the government less room to manoeuvre, and it is fundamentally a political issue, regardless of the details of the contract. And I think that, for example, by rejecting the BMA's proposal a few months ago, the junior doctors have sort of undermined the BMA as a negotiating partner. And I think that there's a real risk. I disagree with the gentleman who spoke earlier. I don't think that public attitudes to doctors are immutable, and I think there's a real risk if we start introducing this sort of action to the NHS that it could fundamentally change public attitudes.
Alex, junior doctor earlier was saying Jeremy Hunt back off. You would say BMA back down.
Well, I think that it's I don't think it's a position where there's an easy win or we'd have found it. I think that the government could have handled itself better, but I do think fundamentally that the long-term risks of a strike are counterproductive. The other point I'd just like to make, because there's been a lot of talk about NHS funding, about the shortcomings of supply. And we also heard earlier, one of the things that people think they're striking about, or some people think they're striking about, is privatisation. Now, my father recently spent almost a year in NHS care, and my mum, who's worked in the NHS for about 40 years, and I helped to look after him, and he happens to be put up in the hospital where she started training. And as we were doing a tour while he was having some tests, she showed me in what used to be the pay wing of a public hospital. And what this did was it brought in private patients, and they paid money which was then spent on the NHS. Now, currently, Britain does have private healthcare. Rich people who already pay all of the taxes towards the NHS pay extra for private healthcare, but currently they go to private hospitals and all of that money gets locked up in the private system. Now, for long term, we've talked about European...
I'm going to really...
We've talked about European...
I need resolutions to this dispute.
We've talked about European models. European models make it easier to bring more money into their health services, and we need to look at imaginative solutions like that to help ease the funding crisis.
Hi. Do you have a resolution?
I do have a resolution. So
thank God for that.
First of all, it's been great to hear from lots of different people from lots of groups.
Brief.
And I will be brief. And the universal thing is that there are problems in this contract. Even Andrew said there's problems. People keep saying, you know, this contract's not good, I don't want this as a contract, but why do they have to strike? Why is there this...
Resolution, sir.
So my resolution, number one, take imposition off the table now.
Yes.
Number two, and this is even more important, if you want to produce a 7-day service, give me a well-costed spreadsheet of exactly what it involves. The government has not done that. You pushed Jeeves and you pushed all the doctors for what percentage would solve this. I'm in my last year. I want resources. I don't want a rise in pay. I want a well-costed spreadsheet. And that needs to come along.
Thank you. Hi.
Junior doctors is basically, sorry, Aisha Raza. I'm a local counsellor in Ealing, and I'm also teaching medical students as well, which is why a lot of this is very pertinent to me. It's money, basically. We need more central funding, and the junior doctors dispute is one of the death by 1,000 paper cuts that the NHS is withstanding at the moment.
Okay. Okay. Thank you.
That's basically what we need, more money.
Hi.
Hello, Victoria.
Hi.
Nick. I work in the railway industry, and in my opinion, the 7-day week is going to be robbing Peter to pay Paul. The 5-day week isn't funded well enough. The 5-day week realistically doesn't work because the NHS isn't being funded well enough. My challenge to Mike Wood and the rest of the Conservative government is to find the money from wherever you need to find it.
Where?
I don't know.
Where? I mean, just...
Philip Green, maybe. Anyone, really. Find the money, give it to them, let the 5-day week work, stop giving these people a hard time. They're amazing people. And then come back to me and talk to me about a 7-day week.
Hugh Pym, as health editor, how do you see this dispute over the next few months, then?
Well, very briefly, Victoria, the two sides were far apart back in May, and it was the Royal Colleges behind the scenes who got them round a table, and then that resulted in the agreement that was thrown out. Now you have a government saying, well, why should we negotiate with the BMA? If they agree something, then it goes to a referendum and it's thrown out again, and it goes on and on and on. So they're pretty set against it. But you have the BMA saying, well, we have 58% of our members who have rejected this contract. So I think it's going to take somebody, maybe it's the Royal Colleges, somebody behind the scenes, to try and get people around a table. But I see that as very, very distant right now.
OK. You've got 10 seconds to give me a resolution. I'm so sorry, Lizzie, but go on.
That's all right.
Quick.
I think for a resolution, I think that the doctors have been ground into the ground. For a start...
Resolution.
Government MPs get paid £70,000 a year. Doctors get 20.
Give them a pay rise.
I think... Well, give them a pay rise to cancel that bit out.
OK.
And also sit around a table and discuss and leave it to the professionals.
All right. Resolution, really briefly, if you would.
Halt the imposition.
Hold
Come back
the
to the
imposition.
table, discuss with doctors, listen to the evidence. We shouldn't be making decisions regarding the NHS on a whim. They shouldn't be about opinion politics. It should be based on evidence.
OK. Briefly.
Yeah, just
brings back to the patient, bring in a risk register, match the risk to the resources, then it's not about percentage, it's about patient safety and efficiency.
Thank you very much. Thank you to everyone who has taken part in the programme today. Yes, you can give yourselves a round of applause if you like.